Good morning, everyone. Today we are here to present our biology project. The topic we have chosen is supportive care for cancer patients. Today we will be looking at the cancer is what type of cancer exists, what is the biological cell progress of cancer, and about a possible cure we designed our fight cancer.
Our group project is research organization and NGO that provides end-to-end support for unprivileged cancer patients. We strive to increase awareness about cancer, help existing patients get treatment and medication for their condition, and help patients cover and lead to normal life, healthy lifestyle. That is our logo on the left side.
Yeah, so our vision is based on a quote written by Joe Wesser that he said that cancer is only going to be a chapter in your life, not the whole story. Because we battle it and win it, with this thought, let's begin our presentation.
Hi there, myself Kmakshi. So, I'm a speaker three in this. Speaker four. So, our group is a Dove Life NGO, which is consists of patient artists, engineers, doctors, journalists, who are researching on a building a microchip that can be used to cure any type of cancer. Let's
I'm Chandan, the leader of this group, as well as a doctor biologist by role. I looked after the biological theory behind the research as well as the project.
I am Anmoldeep, the engineer biologist of this group. I engineered and responsible for microchip physical design and the construction of this PPT.
Hi, I'm Lovepreet. I am artist biologist. I am also the designer biologist of this microchip, and I also designed this presentation.
Hi there, I am Kmakshi. I work as a programmer biologist, and I'm one of the person who will program the microchip. And I looked at the technology aspects of this presentation and the cancer treatment. I am a journal biologist, and I'm the one researching about the publication now, research about the microchip. I will journal the advantages of the microchips. As today we have decided our presentation for you in a four parts: the introduction, our biology research, the exciting solution, treatments and technology, and finally our revolutionary microchip that has the capability to cure the cancer. Okay.
What is cancer? Cancer is basically a disease in which some of the cells inside our body grow uncontrollably and they spread to other parts of the body so that our body start experiencing a kind of discomfort which eventually lead to further problems. If we consider the state of the disease, one and every four deaths in from cancer, and around 1.3 million cases are diagnosed every year. As you can see, we have added a detailed picture of how
ਕਿ
the
ਚੰਦਨ ਗੱਲ ਸੁਣ
cancer.
ਯਾਰ ਇਹ ਸਲਾਈਡਾਂ ਗਲਤ ਦਿਖਾਈ ਜਾਂਦਾ ਤੂੰ ਆਪਣੇ ਸਲਾਈਡ 7 ਤੇ 8 ਦਿਖਾਉਣੀ ਇਹ 5 ਤੇ 6 ਆ ਤੂੰ ਦੇਖ ਤਲੇ ਤੂੰ ਬੋਲੇ ਕੀ ਜਾਨਾ ਅੱਗੇ ਕਰ ਸਲਾਈਡ ਹੋਰ ਅੱਗੇ ਕਰ ਆਹ ਵਾਲੀ ਸਲਾਈਡ ਆ ਕੈਂਸਰ ਦੀ ਇਹ ਬੋਲਣਾ ਸੀ ਤੈਨੇ ਸਲਾਈਡ ਇਹ ਸਲਾਈਡ 8 ਆ ਅੱਗੇ ਕਰੀ ਥੋੜੀ ਇੱਕ ਨੰਬਰ ਹੋਰ ਆ ਸਲਾਈਡ 7 ਆ ਆ 8 ਆ
ਯਾਰ ਇਹਨੇ ਉਹ ਕਿੱਥੇ ਗਈ ਫਿਰ ਸਲਾਈਡ 5 ਤੇ
ਉਹ ਰਹਿਣ ਦੇ ਤੂੰ ਉਹ ਕੀ ਕਰਨੇ ਆਪਣੇ ਸਲਾਈਡ 7 8 ਕੱਢ ਸਿੱਧੀ 7 ਖੋਲ ਪਹਿਲਾਂ
ਓਕੇ
ਇਹ ਬੋਲ ਹੁਣ ਤੇਰਾ ਪੈਰਾਗ੍ਰਾਫ ਸਲਾਈਡ 7
ਓਕੇ ਵਾਟ ਇਜ਼ ਕੈਂਸਰ ਆ ਕੀ ਹੋਇਆ
ਮੀਟਿੰਗ ਕੈਂਸਰ ਨੂੰ ਨਾ ਇਹ 10 ਮਿੰਟਾਂ ਚ ਕਹਿੰਦੇ
what
ਛੇਤੀ
is
ਕਰੋ ਯਾਰ
cancer? Cancer is basically a disease in which some of the cells inside a body grow uncontrollably and they spread to the other part of the body so that our bodies start experiencing a kind of discomfort, which eventually leads to further problems. If we consider the state of this disease, one and every four deaths in is from cancer, and around 1.3 million cases are diagnosed every year. As you can see, we have added a detailed picture of how the cancer look on a microscope level inside a body.
In this slide, we have added the types of cancer. There are 5 different types of cancer, namely melanoma, breast cancer, prostate cancer, colon cancer, and lymphoma cancer, just for the information. These are just the main kinds of cancer. Other than this, there are also other cancers.
So melanoma is also called skin cancer. It is the most serious type of cancer. It basically develops in the microscopic level, that is the cells in our body. They produce the pigment called melanin, that if we all know is the hormone that determines the pigmentation, that is complexion of a skin in rare cases. Melanoma can also form in an individual eyes and rarely inside the body, but still there is a possibility.
As a next is the breast cancer. So basically, this is the most common cancer in females, and some of the reason like why this is a very increasing concern in this the today's in generation is because of the women these days today are very negligent and about their health, and they don't even know like the ineffective smoking and the illusion of alcohol in the woman's body, and is exposed to long duration of radiation which can be led to breast cancer. So there is a risk factor for developing breast cancer that include obesity as a lack of physical due to the lack of physical exercise and alcoholism. However, there are also a way to reduce one risk to breast cancer. One can prevent it by controlling their weight and no smoking, avoiding alcohol, and being physically active and avoiding long exposure to harmful radiation. So, next slide will be explained by the speaker number 2.
Next is colon cancer, as we all know, in the final part of digestive tract through which the feces passes. Known colon cancer typically affects older adults who are about 50 to 55 years of age. It usually begins in very small lump of cells are there that I can't process inside the colon all the time. If not diagnosed in proper time, these polyps can become colon cancer. This risk factor associated with this particular type of cancer is old age and male. It is high and alcoholism, eating too much and meat and processed meats, excessive smoking, etc.
Next is prostate cancer. As you can see, the fact table and the stats are given the diagram that we have attached with the slide. Estimate of new cases. Every year is more the 100,000, and the and mortality rate is around 30%. That is 31,000 in 2019 and 33,000 in 2020. The average diagnosis happen in every 2 to 3 minutes. That is every 2 to 3 minutes. A person is diagnosed with prostate cancer, and an average mortality time is 17 minutes.
The last type of cancer is lymphoma. Lymphoma basically happens inside the immune system. The cells are in the lymph nodes, sperm, thymus, bone marrow, and other parts of the body. The main event that happens in Climophobia is that climatic changes and grow out of control, that is these shape changes. The major cause of cancer vary from case to case, but we can see the main types of cancer that are associated with overweight and obesity. And for the information, these are the
ਓਏ ਚੰਦਨ
ਉਹਦਾ ਫੋਨ ਬੰਦ ਹੋ ਗਿਆ।
ਹਾਂ ਉਹ ਬੰਦ ਹੋ ਗਿਆ। ਆਪਾਂ ਐਂ ਕਰਦੇ ਹੁਣ ਜਿਹੜਾ ਸਪੀਕਰ 2 ਦਾ ਗਾ ਉਹ ਮੈਂ ਬੋਲ ਦਿੰਦਾ ਫਿਰ ਸਪੀਕਰ 2 ਤੇ 3 ਦਾ
ਹੈ
ਸਪੀਕਰ 2 ਤੇ 3 ਮੈਂ ਦੋਨੇ ਬੋਲ ਦੂੰਗਾ। ਉਹ ਪ੍ਰੋਫੈਸਰ ਨੂੰ ਕਹਿ ਦਾਂਗੇ ਮਾੜੀ ਜਿਹੀ ਪ੍ਰੋਬਲਮ ਆ ਗਈ ਉਹਦੀ ਆਵਾਜ਼ ਦੇ ਵਿੱਚ ਏਦਾਂ ਕਹਿ ਦਾਂਗੇ ਕੁਛ ਉਹ ਤਾਂ ਕੋਈ ਚੱਕਰ ਨਹੀਂ।
ਪ੍ਰੋਫੈਸਰ ਨੇ ਮੰਨ ਹੀ ਜਾਣਾ, ਕੋਈ ਗੱਲ ਨਹੀਂ।
ਨਹੀਂ ਉਹ ਇੱਕ ਵਾਰ ਸਬਮਿਟ ਕਰ ਦਾਂਗੇ ਬਸ।
ਆਹੋ ਚਲੋ, ਉਹਨੇ ਕਿਹੜਾ ਸੁਣਨਾ ਆ।
ਯਾਰ ਪਿਛਲੀ ਸਲਾਈਡ ਤੇ ਕਿਉਂ ਨਹੀਂ ਜਾਂਦਾ ਪਿਆ?
ਕਰ ਲਓ ਜਲਦੀ ਪਲੀਜ਼ ਗਾਇਸ, ਮੈਂ ਬਾਹਰ ਖੜੀ ਆ ਇੰਨੀ ਠੰਡ ਵਿੱਚ।
ਤੂੰ ਉਹਦੇ ਨਾਲ ਚੱਲ ਜਾਣਾ, ਕੋਈ ਟਿਮ ਖੋਲਾ ਹੋਊਗਾ ਉੱਥੇ ਦੇਖ ਲਾ।
ਕੋਈ ਟਿਮ ਟੁਮ ਨਹੀਂ ਹੈਗਾ ਨੇੜੇ ਯਾਰ।
ਓਏ ਪਿਛਲੀ ਸਲਾਈਡ ਕੱਢ ਹੁਣ ਕਿਹੜਾ ਕਿੱਥੇ ਸੀ ਕਿਹੜੀ ਸਲਾਈਡ ਤੇ
ਯਾਰ ਮੈਂ
ਸੀਗਾ ਉਹ?
ਪਿਛਲੀ ਤੇ ਕਰਦਾ ਪਿਆ, ਹੁੰਦਾ ਨਹੀਂ ਪਿਆ, ਪਤਾ ਨਹੀਂ ਕਿਉਂ। ਇੱਕ ਤਾਂ ਹੈਗਾ ਉਹ।
ਕੀਬੋਰਡ ਨਾਲ ਕਰਕੇ ਦੇਖ ਲੈਣਾ ਕਿਹਦੇ ਨਾਲ ਹੁੰਦਾ।
ਸਲਾਈਡ 14 ਤੋਂ ਸ਼ੁਰੂ ਕਰਨਾ?
ਹਾਂ
ਚਲੋ।
The last type of cancer is lymphoma. Cancer lymphoma basically happens inside the immune system. The cells are in the lymph nodes, spleen, thymus, bone marrow, and other parts of the body. The main event happens is the lymphoma. Is that lymphocytes change and grow out of control. That is, the shape changes. The major cause of cancer vary from case to case, but we can see the main types of cancers that are associated with overweight and obesity. And for the information, these are just the basic type of cancers. This is shocking because 13 type of cancers is just from obesity. Here we have attached a pie chart to explain the deaths due to cancer and other causes in Canada in the year 2019. As we can see, a major 28.2% of deaths in Canada was from cancer in the year 2019. So that explains how big of a deal cancer is.
Okay, so now we move to the second part of our research. That is the analysis that we have all done on the cell suicide. Now, what is programmed cell a cell that cell suicide? Cell suicide on the circular level is generally called apoptosis. It is a very normal and a programmed to process of circular self-destruction. Even through the name suggests that cell suicide acts as a healthy and a protective role in our bodies. This is actually healthy because to create something new and a healthy, space must be created and the old toxic cell need to be replaced.
The next question that arises is how do cancer cells evade apoptosis? In general cases, the cancer cells may escape a process by increasing the expression of anti-apoptotic genes. They may also hinder the quantity of apoptotic genes. This means also that it sometimes starts to destroy healthy cells instead of unhealthy cells. The next slide shows the graph of positivity, that is the rate of survival in cancer. Now there is the estimate number of cancer survivors in the US during different years as shown in the graph. As we can see, every year the number of cancer survivors are growing at a very fast rate. This indicates that the treatment of cancer is getting effective day by day.
Okay, so now this next slide shows in the percentage of a cancer that is. So now the next slide shows the percentage of cancer that survivors by age. We can see even a major percentage is contributed by 70 to 79 years individuals. And the next will be shown by the speaker one.
Now we come to the next and very important part of our research. That is what is the difference between cancerous cells and normal cells. As we can see the growth of normal cells. So when there is enough, but the cancerous cells keep on growing, just like growth, other criteria are also shown in slides such as Aprit's function and blood supply that is provided to normal cells. And the cancerous cells are, we can see a clear difference between how healthy the normal cells are and how dangerous the cancerous cells are.
Okay, so the slide shows the diagrammatic representation of how in reality a normal cell is and how a cancerous cell is.
Now we come to the next part, that is existing solutions and treatments. The technology used for the treatment of cancer mainly involves CRI, SPR, artificial intelligence, gyro electron microscopy, and robotic surgery.
So there are also another three possible treatments of cancer, and one of them is chemotherapy, another one is surgery, and last one is radiation therapy.
Okay, so chemotherapy is just basically using powerful chemicals to kill the fast growing cells in the body. As chemotherapy is majorly used to treat cancer cells. Cancer cells grow very much quickly than other cells in the body. As radiation therapy used on a DNA, as in this high energy radiation is given to the cancerous cells that basically destroy their ability to move and grow. As the machine through which is therapy is given is called a linear acceleration. The next slide will be explained by the speaker one.
And obviously, a very major role in the treatment of cancer is played by surgery. The idea behind the surgery is that cancerous cells can be removed artificially from inside the body by complete surgical excision so that there is no sign of cancer after the surgery inside the body.
This
This
slide shows
slide
a very systematic differentiation between chemotherapy and radiation. As we can see, chemotherapy uses drugs and radiations use high energy beams such as X-rays. Chemotherapy can be oral, intravenous, etc., where radiotherapy is extremely internal.
Okay, so now we move to our final part of our presentation, that is revolutionary microchip. We have kept the solution part for the last, as the doctors are continuously making new medicines to fight this deadly disease. However, one such wonder drug is neosporin, a bacillus tablet that can work like a miracle in a patient.
The Neosporin Bacillus tablets are very heavily chain of protein that connects itself to the bad cells and prevents it from multiplying or harming other cells. Here we can see a photo of cancerous cells and neosporin attaching itself to it. The medicine effectively connects itself and releases a chemical that breaks down and corrodes the bad cells. Finally, cancerous cells get dissolved in the body and new healthy cells are created and cancer is cured.
The one way is through targeting the apoptosis mechanism to kill the cancer cells. But the drawback in this particular method is that it is still in progress and in researching stage. So the data is yet to be compiled for clinical trials. However, all scientists agree that using medication we saw, the neosporin bacillus can be effectively used to stop the apoptosis hacking mechanism of the cancer cells.
Okay, so now the most important part we at Dove Life NGO have developed a microchip that will be acting as a game changer in this treatment industry. The concept behind this microchip will be a very simple application of everyday biology, and the same way we eat medicine and they work at the target area in the same that day. This microchip will release chemicals that are based on the chemotherapy mechanism.
Why we believe this will work is because these chemicals will release inside the body through the chip that will be implanted on a specific target site near the cancerous cell. Those chemicals will slowly and eventually corrode the cancerous cell and leave the healthy cells uninfected. And the result, the patient will cure from cancer and will be back to living a healthy life.
This will be lesser invasive than surgery, quicker to act than chemotherapy, and much safer than dangerous radiation therapy. We strongly believe that this microchip could be game changer in the treatment industry.
So yeah,
Thank
there is
you.
the end of our presentation. We all thank you.
Thank you.
Thank
Thank
you.
you, everyone.
Thank you.